We're on? Okay, today we're going to start off having a review regarding the male reproductive system. I'm doing this in a series of questions. This follows what we covered last class. But I need your help. I need you to read some of these. I want some of your reactions. It's not going to just be me. So we'll spend about 20 minutes reviewing the male reproductive system through a series of questions. Then I'm going to talk about the female reproductive system. And I broke it up into 3 different areas for you. First, I'm going to talk about the external genitalia, the clitoris, the vagina, the labia, etc. Then I'm going to go into the internal organs, the ovaries, the fallopian tubes, and your uterus, uteri. And I'll talk a little bit about functioning of these organs. And the last section will be about ovulation and menstruation. And that's when I'm going to slow it down. I'm going to want you to know a little bit about how it works. For once in your life, I want you to understand why women have PMS. I want you to understand when you have a reduction in progesterone that you reduce feelings of exhilaration. I want you to understand how the pill works. I'm really tired where people have a little bit of information, not enough. Okay? So first I'm going to talk about the male. We're going to do this through Q&A. And then we'll have some beginning questions on the female that you can ask me, whatever you choose. All right, who wants to read the first one? Just read it for me so I hear it. I don't have to turn around. Can you do that?
What are the organs that secrete a substance which make up the ejaculate in the male?
Okay, so what makes up the ejaculate in the male? Which 3 organs? Someone want to give it a shot? Yes, sir.
Ampulla. Is that the first one?
Ampulla of the vas deferens.
All right.
So far.
Seminal vesicles.
Seminal vesicle secretion, and one more.
Prostate gland.
And the prostatic secretion. Those 3 organs secrete a substance that includes sperm, that includes fructose. The seminal vesicles provide fructose, so you have nutrients. And the prostate gland secretes a bicarb in water, which helps neutralize the acid of the overall spermatic fluid when it enters the vaginal barrel. It could live. What is not part of the ejaculate? Which organ secretes the pre-ejaculatory fluid? Yes, sir. Cowper's gland or bulbourethral gland. These 2 glands on either side here. You can see that. That's real good. And can you get pregnant from pre-ejaculatory fluid? Someone said sure. Not likely is what I want you to remember. Not likely because you need enough of the enzyme hyaluronidase, which are found in the head of sperm, in order to break down the wall of an egg and fertilize it. But let's not get crazy. Anything's possible, and you should not be using that as a birth control method. So, not likely.
The Cowper's gland was...
Cowper's gland.
What was that?
These are 2 glands that will secrete a substance right before a man ejaculates, called pre-ejaculatory fluid, which will help neutralize the acid in the urethra. The urethra goes from the urinary meatus, the opening here, all the way through right into the bladder. So that when these substances are secreted by the ejaculatory duct, Cowper's gland prevents the sperm from dying by neutralizing the acid in this urethra. Your urethra is the organ which connects your bladder to the outside of your body. Above that, up here, you have things called ureters, U-R-E-T-E-R. The ureter, 2 of them, connect to your kidneys right above. So your kidneys are going to be filtering and cleaning the urine, and it comes back down through the urethra and outside the urinary meatus. Cowper's gland secretion is responsible for neutralizing the acid inside the urethra. So we have the Cowper's gland neutralizing acid, and then we have prostatic secretion neutralizing the overall ejaculate. It's an amazing system how it works together. Whether there's a God or not, it's kind of amazing how things work together. Our bodies are just miraculous. Okay? Let's move to the next question. Would you read the next one?
What is the most sensitive area of the male genitalia?
What's the most sensitive area of the male? Well, first of all, the most sensitive area is whatever a guy likes. You understand that? So let's not take this as a classroom, and you have to understand, you'll find out what guys like, ladies, and guys already know what they like. There's many sensitive areas in their body. The anal region has a huge number of nerve endings. The scrotal sac has a huge number of nerve endings. But the most sensitive part is what? Yes, the glands. And that's G-L-A-N-S. That's the glands, the head, the tip, the crown, coronal ridge. That's the most sensitive part of the penis. The root, which is right back below the pubic bone back here, and the shaft, which is the major portion of the penis itself, is sensitive, but not as much as the tip. Okay? Any questions? Any comments? Anything you want me to elaborate on? You're good? Okay. This is just the physiology of the penis. There are two large, there's three areas that will fill up with blood, the corpus cavernosa and the corpus spongiosum. There's no muscle in there. It's all connective tissue and a sponge-like material that will engorge with blood. That's how a man gets an erection. It fills up with blood. It's not anything that you can work out and get bigger and stronger, although there are muscles around that area that can be exercised so you can have a little better control. Control of what, I don't know, but I can tell you that it does help men who are premature ejaculators, come too fast, come before they choose to. There are some guys that make it into a game. You know, you just let me know 3 seconds before and I'm ready. You know, they think it's not a game, it's not funny, and guys are not that good. They could say they're that good. That's why coitus interruptus or withdrawal is a method that should not be used as a birth control method because it's not used all the time. People always ask, would I get pregnant if a guy comes outside of me all the time? No, you're not going to get pregnant unless you have sex with someone else during that period. A lot of people find out, how did you get pregnant? I had a vasectomy. I always withdrew. I don't know. You know, they end up on Maury and other shows. Oh, it's someone else. You know, people ask me, can I get pregnant in a swimming pool? Yes, if you're having sex in a swimming pool. Do you understand that? But sperm aren't going to be doing breaststrokes, you know, going in. How about on a toilet seat? Same thing. Don't have sex on the toilet seat. You get pregnant because of the ejaculate being inside you. And then it's not all the time. Then it's 4 out of 100, one time only. Then it's 4 out of 5 over a year period of time if you use no birth control. Not as easy as it sounds. Let's move on. Next question. Would someone else read this, please? Those people that are watching this tape, we have to wait.
Does the size of the male genitalia vary in size?
They do vary in size. The flaccid penis, the non-erect penis, is anywhere from 3 to 6 inches when non-erect. And what's interesting, which I told you last time, we have growers and showers. The short penises will enlarge more geometrically. So that if you had a 3-inch penis, when it stood erect, it might go to 5 or 6, 100% increase. Compared to a 6 or a 7, that might go to an 8 or a 9, a 25% increase. And that's all I want to say about size. You know, someone asked me a question before a class about, you know, how do things happen? And we'll get to it when we get to the female. I don't want to go there now. Any questions about size? We talked about the black, white, and other races, size of penises last class. Yes, it's a myth, but don't be stupid. If someone is a very large man, chances are his penis will be a little bit larger than average. And someone is very small, same thing. But don't ever think that you know, because everyone is an individual. And as I told you before, there are some guys who will tell you, yes, he was only 5'2", but forget about it. Huge. You know, and we have jokes about this. So don't think you know, oh, look at his feet. Woo! You know, it doesn't transfer over as easily as you think. Does size matter? It's up to you. We already discussed that. It's what turns you on, what you think about. Let's move forward. So would someone else, would you read this next one?
What is the functions and purpose of the scrotal sac?
the major function of the scrotal sac is to protect the testicles that are inside of it. And it also has hair and sweat glands to maintain body temperature. Your body temperature is much higher than the temperature inside the scrotal sac. If your temperature in the scrotal sac gets too close to body temperature, it will affect your sperm development. Other things that will affect sperm development are altitude, radiation, stress, trauma, job, occupation. If you're seated all the time and your scrotum are too close to the body, it often affects sperm count. Someone asked me last class about hot tubs. Hot tubs can be a little bit destructive if you take them all the time. Same thing with the underwear that kind of doesn't let the boys breathe at all, okay? And I'm not telling you to select underwear based on sperm count, but it is known that you want the scrotal sac to be external. And the closer you pull them to your body all the time, the greater the chance you will have some reduced sperm count. I didn't tell you last time that, in general, if you have 1/4, 25% of your overall sperm are defective in any way, and we could talk about that, generally you're going to have fertility issues. You know what it doesn't mean all of them. Yes, it's 2 to 600 million with each ejaculate of 3 milliliters, blah, blah, blah. But I want you to know, I would be concerned. I wouldn't be, every day, sorry, I got to walk around nude, don't use it as an excuse. But I would be conscious of the fact that cold showers and baths are better than hot all the time. If you need a jacuzzi, take a jacuzzi for athletes who need muscle attention. But make sure that you don't overdo it, which is hours per day. And some people do it. First thing that they do when you have a low sperm count is they put you in ice baths. Let it go with that. Okay, the next one. What's the purpose, function, and structure of the testicles? Well, the testicles are everything. They contain, they produce hormones that give you your secondary sex characteristics. They affect a variety of sexual traits. They affect your reproductive organs. And they also produce sperm. It might take 72 to 90 days to produce, but it's in the testes. And that's why the scrotal sac is very protective of that. Everything is happening in here. If you only have one testicle, if it was trauma or testicular cancer, you still can have children, you still can produce, you still will, it's not guaranteed that you will not be able to, I should say. Of course, the odds are always reduced. Same thing in the female. If a female only has one fallopian tube and one ovary compared to 2, and even if they're on different sides of her body, which we'll show, she still can have the ability to fertilize eggs and house a growing embryo. It's not necessarily a life sentence when you lose an organ like that. It's not good. It's just not a life sentence. Any questions about the testicles at all? This is a close look at the testicles. You have the epididymis, you have the seminiferous tubules, the mile worth of network for 5-6 weeks. This is where sperm are manufactured. They move into a cork-like structure in the middle, which is not on this slide, called the rete testes. This is what filters out defective sperm. Then they move to the epididymis over here, and this is where they're ready to go. They mature. They're going to move into the vas deferens. And once they move into the vas deferens, these are your mature sperm ready to go into battle. They got helmets. They're ready to go. These are the first ones out, and they line up for battle. Any questions about the inner workings?
Can I throw in a laugh that's incredibly related to this?
It's your class. Do whatever you choose.
Right. Did you hear about the guy in New Orleans that donated his testicle for a Super Bowl ticket? He was going to trade it, and he put it on Craigslist. He called it like ball for ball at something.com. And
Well, did he do this before he had an offer?
No. But
That he's willing to give a testicle for a Super Bowl ticket?
yeah, I heard it on Bonaducci in the morning.
Nice. Oh, well, that's credible. All right.
No, he called. The guy called.
Here's my take. I believe it. There's so many things that go on that are just, there's crazy people, there's freaks. You know, would you give up a testicle? It's a Super Bowl. If I said who won the Super Bowl 3 years ago, you don't even remember who played. You just know the Eagles weren't there. That's basically one testicle for a ticket. You know, you think you'd want to go with someone. If you're going to give up a ball, you'd want 2 tickets. You know, what's the 1 ticket? You need a friend there just with ice alone and gauze. I guess Dr. Oz will have to do the procedure on TV. I'm sorry. Thank you for the levity. It's crazy. But are there crazy people? Of course. That's why I believe it. You know, when people say, I have a friend who, I know, it's not you. Everyone has a friend who, you have some crazy friends. That's all. I've been in a university or in a university setting my whole life. I really have heard it all. I've written a few books about it. I have heard it all, but hearing it all means in 5 minutes I'm going to hear something I never heard before. Nothing shocks me. Thank you very much for that. You a Phillies fan or you just wearing the hat? Okay. The pathway of sperm is the next question. What is the pathway? I already went through this, but I'd like to go over it. And when I'm going to be dropping in the slides so that you'll be able to see this clearly when I post it online. But they start in the seminiferous tubules. They work their way to the epididymis. It then moves into the vas deferens, comes around, and here's where they all meet in the ejaculatory duct. The ampulla of the vas deferens, the seminal vesicles, and the prostatic secretion all meet right here. They meet in the urethra, in the area that you urinate from. They meet there. So there's an opening there. You know, everyone's saying, well, they meet there. How do they, do doors open, you know? No, it actually opens up right into the urethra at one spot so all can mix together, the entire seminal fluid. Yes? Remember last class I said I don't have a name for the door. I have names for everything. I'd like to make up a phony name so I don't have the question year after year. But right up here, you have a doorway that when a man has an erection, that doorway stays closed so he can't urinate and ejaculate at the same time. If he's semi-erect, he actually can have both going on at the same time. I'm not saying it's recommended or not recommended. It's just physiology. There's no name for that doorway. That doorway is often damaged when men have prostate surgery and they have to go through the penis and they drill away tissue around the prostate gland to open up that particular area that is either cancerous or just inflamed due to infection. And through that procedure, they often damage the door. So as a result of that, instead of ejaculate coming around here, sometimes the ampulla empties its sperm cells directly into the bladder, and this is called retrograde ejaculation. Retrograde means it gets diverted into the bladder. Then there will be some urinary tract infections that will signal something's wrong. It does not in any way reduce one's ability to feel the sensation of orgasm/ejaculation. In the male, orgasm/ejaculation, they occur at the same time. That's why, you know, we get confused, but they're totally different. An orgasm are really your sacral portion of your spine sending signals, nerve impulses, to your pleasure center in your brain that triggers feelings, good feelings. It feels like it's down here. It feels like it's inside the walls of the penis and that region, but it's really here. It's hard for you to imagine that, but this is where your pain and pleasure centers are. Ejaculation is just contractions in the walls of the penis as well as in the around the prostatic glands and seminal vesical glands. You have about 6 to 8 contractions that will propel sperm outside the body. They're about 0.6 seconds apart. So you have between 3 and 5 second duration of a man slobbering all over you, heart rate increased. When a man ejaculates, they let out weird noises, they drool on you, and all that other stuff. Or if they're alone, they drool also there, you know. Men have been socialized when they start sexual activity, any type, they've been socialized to come, to ejaculate. So that question of where does blue balls come from, when they're pent up, when they have this tension, they've been socialized to release it. And it is believed that that tension is what causes blue balls. It's still not, the jury's still out, because sometimes, again, you could be anywhere, and you have this feeling, this very uncomfortable blue balls feeling. Someone didn't ask me this question. They asked me after class, and I guess it was an email. They asked me about shrinkage. Now, you remember the Seinfeld episode? George goes into the pool or the ocean, and he comes out, and Jerry's girlfriend walks in on him, and it shrank. It gets smaller. Well, cold temperatures and water will cause some shrinkage. And I remember there was a line in there, something like, they're very temperamental. They have the mind of their own. Well, the issue is, does shrinkage really matter? Most of the time, a man and a woman get together. You don't have to worry about shrinkage, because a man will almost always have an erection. It's only when the penis is flaccid, or you're just coming, you're getting undressed, that it's possible that you have this shrinkage. I wouldn't worry about it. I wouldn't harp on it. I just let it go. But there really is shrinkage. As well as I told you last time, the scrotal sac themselves take on different appearances. Sometimes they're shriveled up like a prune, and sometimes they're very shiny and smooth. That's when a man has an erection. When a man is he's not excited, when he's not at the excitement phase of sexual response, it relaxes. Any questions about shrinkage or anything like that? No guys are going to ask this question, right? Yeah.
Kind of similar, but not really. At what age does a male
12.
be able to? Because when babies can have erections.
Babies have erections. Young boys have erections. Old men have erections. Erections are something almost spontaneous, and we don't really know what causes it all the time. But as far as his ability to ejaculate, that usually comes following heavy doses of testosterone, and it varies in age, but it's usually when a boy becomes a teenager in those years that his first ejaculation occurs. This is when a guy, for the first time, says, "Mom, it's okay, I'll clean the sheets, I'll do the laundry." What do you mean you'll do the laundry? Whether he has a wet dream, whether he ejaculates in his sleep. But things happen when you're going through puberty, and not just your voice changing, a lot of changes. Good question. All right? Let's move forward. What is ejaculation? Is it different than orgasm? I just mentioned that. We good? Okay. The ejaculatory process. Ejaculation is different than orgasm. In the male, orgasm are really impulses, which I just told you, from the sacral portion of the spine, blah, blah, blah. Ejaculation are muscle contractions that propel the ejaculate from the ejaculatory duct to the urinary meatus. I told you there were 6 to 8 at 0.6 seconds apart. There we go. Sometimes I get the timing wrong, but I can tell you it's a short period of time, the whole process. Next question. What's the pathway of sperm? We did that. We don't need to do that. By the way, in your slides, it has the actual pathway. When I ask you on your test, what's the pathway, I want you to think in terms of more. We got seminiferous tubules or epididymis to the vas deferens, and then we have other organs. As the ampoule of the vas deferens comes around, you have prostatic secretion, seminal vesicles, and it ends here. Secretions by Kaplan's gland is not part of your ejaculate. This is your pre-ejaculatory fluid. And then semen is expelled from the penis through ejaculation. I think I told you it's about, it's just about the size of a teaspoon in amount. It changes color based on the amount of prostatic secretion. Prostate gland gives it its color and odor. The seminal vesicles provide the amount. So that each episode of sexual activity in a short period of time affects the amount and consistency of the sperm. So after 3 or 4 times in one short duration, the ejaculate will become water-like, as opposed to the first time, it'll be more glue-like That's due to seminal vesicle secretion reduction. Circumcision, what is it? I mentioned it yesterday. It's basically removal of the prepuce or the foreskin on the penis. Just a couple of things about it. It's more common in the United States and Europe. It's related to hygienic, cultural, and religious reasons. It occurs about 2 days after birth for people who are not Jewish. And Jewish people wait 8 days. It's a tradition, and it is what it is. Any questions about circumcision? Yes.
Can it be done like when a person's like an adult?
Yes, it could be done when a male is an adult, but let me give you a couple of things. Number one, and I think 6 out of many thousands of students that I had this procedure done when they were older. So I had 6 autobiographies to read about it. It was so painful to read. I can't imagine what it was like. It was not a minor procedure. It's, you know, it's kind of like, you remember that tonsillectomy? Don't worry, we're just taking out your tonsils and you want to kill people after that? Or you're having your wisdom teeth removed. It's nothing. And you're like groggy and drugged out and swollen and all that. Well, it's that 10 times, all right? So I could say, yes, it occurs. In Judaism, many times males go through the whole procedure, both spiritually as well as physically. I'm just saying this. If you have to make decisions as parents about whether your child is going to be circumcised when you have a boy, I think it's a good idea to discuss it beforehand. I think it's a great idea to have it done when a baby heals in 2 days, not 2 months, if you understand what I'm saying. And the question of whether it's good or not good, whether it's, you know, we talked about smegma before and the waxy substance that occurs. I didn't give my opinion because no one asked that. I just want you to know that it's not a bad idea. It's good for hygienic reasons, and that's about it. But you should talk about it beforehand, and don't wait a year and 5 and 10. Because right after the first year in general, things don't heal as quick. You wouldn't believe a baby. They come out all squashed up, head is all different angles. That's my baby? That's an alien. And then it kind of, you know, comes to what it's going to eventually look like. And then sometimes there's pictures taken of this baby. You send it off to grandparents, and they don't want to come to see the baby because it looks like a zoo animal. All right? And this is not a joke. You know, they had a long journey. They had some pipes to crawl through, and it's not so easy, you know? And that's what happened with my daughter. We sent a picture to her papi, her grandfather, and he was petrified to come and see her. So when he saw her, and she was you know, when people say all babies are beautiful, no. Everyone's beautiful. We get that. But not all babies are beautiful. Sometimes, what is that, you know? Anyway, so this daughter we had was really a beautiful baby. Small, pink, a lot of dark hair, you know, the big eyes and all that. So when he saw her, he never let her go. He was so afraid that it was, you know, he'd need admission to a zoo that for years, he just was so happy. So don't take those quick pictures. And as far as videos in the room itself, why? What is it? Why? This is not a time when your wife is cursing at you and throwing things across the room. You think it's pretty? It's natural. It's beautiful. It's childbirth. Okay. You know, I mean, okay. You're going to have to edit some of those F-bombs out when they're yelling at you, guys. Now, I think it's great to be there. In my case, my wife said, I need you to rub my back. So for 6, 7, 8 hours, you're rubbing their back, giving them ice chips, and doing whatever you want, breathing with them, Lamaze, Le Boyer, all those methods. And when it was all said and done, my wife says to me, by the way, it didn't help at all. My hands were exhausted, you know. Of course, I had a very small job, but didn't help at all. Great, thanks. You know, you think someone would throw you a bone like, thanks for being there. You got any food? Was the second thing she asked, because, you know, you don't eat for like a long time. It's a long process. Food, and you didn't help me at all, you know. I should have known. No, anyway, it was an amazing, life-changing process. But the videos, I think you already realize, don't put everything on YouTube. Yes, sir.
How long would it take for an adult to heal from circumcision?
Again, I can't say. It has a lot to do with your overall healing powers. But it takes at least a month for this process to heal, and I'm thinking more like 2. I'm talking about the first 2-3 weeks of excessive pain. To me, you're healed once the pain goes away. Okay? And that's how long it takes. But we need to speak to an RD, a real doctor, about more details of that. And I do, but I don't want to give any medical information. I'm a PhD, not an MD or a DO. Other questions? Okay. The prostate gland, prostate cancer. We have inflammation of the prostate or prostatitis. I don't want to talk about that. I want to talk about prostate cancer. Generally, you have some major symptoms: decreased urine flow, back pain, sometimes constipation, passing urine at night, blood in the urine. Because the prostate gland surrounds the urethra, you have a lot of pressure on that organ, so many things can occur. All right? If you see here, this is a little bit old, I'm sorry about that, but there was about 200,000 cases in the year 2001. It's actually gone up. 31,000 men died. It's the second leading cause of cancer deaths among men. Now we have the prostate-specific antigen, or the PSA test, which is a great test. So you can have a blood test, and they can kind of identify any irregularities you might have with your antigen number. Doctors are looking for changes in the number, not just increases in the number. People say, oh, my test went up. Up doesn't matter. Severe shifts matter, because it does identify specific cancer. Prostate cancer is one of those cancers that will kill you if untreated, generally. But 4 out of 5 men, I think it says it here. No, it doesn't. 4 out of 5 men live 10 years afterwards with that. Here are some stats. Yeah, I thought I had some. 79% of men with prostate cancer survive 10 years, and 57% 15 years. When you consider the age at which men are likely to get prostate cancer, well, then when you start adding on 10, 15 years, it usually does not have to... prostate cancer will kill you if you goes untreated. We need early detection. But I want you to know it's one of the treatable cancers. They have drugs that direct its energy directly into the prostate. They have seeds that they can implant, hormones, chemical, radiation therapy. Really, there's so much that has been done. But at around age 40 to 45, even 50, it's recommended that you have a rectal exam by your doctor to check for any irregularities in the prostate gland. Basically, they put some Vaseline in a glove. They ask you to bend over, and before you know it, you got a date with a doctor. You know, it's uncomfortable. It's weird. There's no way to explain it. It's just like being in stirrups, you know, at a gyno. I don't know what that's like, but I can't imagine. Put your legs up, spread wide, and we'll stick this extremely cold speculum inside you. You know, guys are worried when you have to have this test. You got your things, we have ours. Anyway, they could tell if it's enlarged or irregular, and then they go from there with other tests. But it's really recommended, and you can't get around it. You know, it's not like, you know, you could say there's other tests. They still do it the old-fashioned way. But that's only a preliminary test, and I would pay attention to it. Do males have menopause, amenopause? Males do have a reduction of testosterone when they get older, same thing as women do, similar ages, in fact. So I have to believe that their moods and their disposition would change just as women. But women, it's a lot more specific. Because of childbirth, we spend so much time and energy paying attention to this. But as far as we know, there's no real menopause where you're going to have hot sweats and flashes and moodiness. But men do have the similar changes as women. We just haven't put it into a scientific framework yet. All right? Breast cancer. I just want you to know, men get breast cancer. About 1,000 men each year die from cancer, breast cancer. We got the 3-day walk for women now, coming up and all that. 1,000 men die from it, and they should be checked, but it's not as traumatic because their breasts are not tied to them as sexually as females. Yeah, you know what I mean. If you're a guy and someone likes your breasts, you're in trouble, you know. You know what I mean, right? You better get to the gym. Right. Testicular cancer. Most common form of cancer in adolescents, usually between 15 and 40. There's only about 7,000 to 10,000 cases each year. And I say there's a big gap because now they're doing more testicular cancer screenings than ever before due to Lance Armstrong. But men generally live through it. If you lose a testicle, generally you could still function. But there's something I want to tell you, some predispositions. It says a risk factor are undescended testicles, family history, occupational toxic exposures, and HIV. Here's the one I want to talk about, undescended testicles. So I'm going to ask you to use your imagination for a little bit, and I want to talk about testicle descent, all right? You with me? So imagine this. We went through the male reproductive system. Now, it's there, but there's also abdominal space there as well. And in this abdominal space, what happens is during, I told you this, that somewhere around 5 to 6 weeks of development, we are all female. And then the certain ducts that will form to make us female or male, continue for you to be female or make us into male. Now, right before your mothers were ready to give birth, guys, around 8 months of development, about a month before, the testicles, they develop high up in the abdominal area. I was trying to figure, what's this weird thing? It's the microphone. I thought I'm going to die. Oh, I didn't have this before. I'm sorry. So they develop high up in the abdomen. And about a month before, they descend down so that they could be housed inside the scrotal sac to be at a good temperature when they need to start developing sperm. Do you get that? Hello? Okay. Now, once they pass this, a place in your body, guys, it's called the inguinal canal. Inguinal canal. The testicles drop down these two openings called the inguinal canal and drop down into the testicle area, into the scrotal area. You got that? And what happens is scar tissue will form over this inguinal canal where the testicles pass by, and it will prevent any organs from coming through it or dropping down into it. This is what we call herniation. When it's not covered completely and there's little abnormal openings in these membranes, your large intestines is very close by this whole process, and your large intestines kind of push against this inguinal opening that I mentioned, and that's what a herniation is. When you hear a guy has a hernia, it's not in his scrotum. It's in the inguinal canal that left some tiny opening, and the large intestine starts putting pressure on it. So when you hear, oh, you had a hernia, it's not here. It feels like it's down there. But you could have herniation anywhere in your body, in the esophagus. Some people get older, they have reflux openings, abnormal openings anywhere. Women can have herniations, and it's never just lifting heavy stuff. You know, oh, don't lift that, you'll get a hernia, you know. No, when you lift something and it hurts and you rip something, it's usually the straw that broke the camel's back. And what I mean by that is there was constant tearing and opening there to begin with, so that you did something strenuous. It was just the end of the cycle. It was going to happen anyway. Doctors always ask you, what did you do right before? And that's what they attribute it to. Same thing with low back pain. But anyway, do you understand herniation is in the inguinal canal? And then you have something called strangulated hernia. A strangulated hernia is when the large intestines actually enter into that pocket, and it puts pressure on the large intestines and can cut off blood supply. That's what strangulation means. But you don't have to worry about going to a doctor. You'll be in tremendous pain at that particular point, and they usually, procedurally can do this. Now, the term given for undescended testicles, it's a good word, you might need it on Jeopardy, is called cryptorchidism. 99% of all males their testicles descend down naturally. Of the 1% that remain, half of them will descend down in the first 3 months following birth, and so 1/2 of 1% need a procedure to help these testicles descend down into the scrotal sac. I'm sorry I didn't cover that last time, but do you have an idea? Do you have a picture? I want you to get it. So when someone says, oh, yeah, having a hernia, no, it's an abnormal opening in the inguinal canal. It's not something wrong with your testicles. I see a hand. Yes, sir. Same thing. It's easier. They don't know that it's a hernia yet until the baby can communicate. You know, again, crying all the time. You're talking about a baby or a year-old. What are you talking about? This explains a lot. I'm kidding. But do you understand? You know, I want people to understand this because it is something that has nothing to do with sex in any way, shape, or form. Even your organs. All right. So, yes.
Sometimes I heard this story about a baby from a nurse actually that a mom called and like frantically like screaming and stuff because the baby, like she said, the baby lost the scar, like they were no longer there. And she was freaking out.
Yes. Now, your testicles can they can drop up again, as they say, and it's not caused by gravity. You know, you don't want to, you know, if you hold your kids upside down, they're going to go back. No. But there are many. This is not a few. There are many baby boys that their testicles, one usually, not both, gets back up, clogged up in the inguinal area, and they know what to do now. Now with technology, they could see everything. So it used to be, oh, we think, because X-rays only look at bone and you could see some tissue around it. Now with MRIs and CAT, they see it, okay? And they also have scopes, little openings they can make. They don't have to do invasive type of treatments and interventions. So yes to that. I don't know normal is the right word. It's frequent, more frequent than, you know, you hear about it when it happens. But remember, you know, we have millions and millions of babies born in this country each year, millions. So not as frequent as you think. But when it happens, people get on the top of, you know, houses. My baby has undescended testicles. No, they don't do that.
This might be a little bit but
Can I break a penis? Can a penis be broken? No. Because it's not a bone, although we call it a boner. It is soft tissue. It's like Dwight Freeney, who's going to be playing Sunday, kind of, has a sprained ankle. He has torn ligaments. It's soft tissue. Now, can it be ripped off? Oh, yeah. Can it be bitten off? Lorena Bobbitt. Lorena Bobbitt got upset with her husband, so she bit his penis off and then went in a car, drove, and threw it out the window. This is a number of years ago. And they found the penis. They reattached it. Oh, yeah. They reattached it. And this is, you can't make this up because, you know, he later went on to become a porn star, and his name was John Wayne Bobbitt. I can't make that up. It's so true. Now, the problem was all people in relationships, men, couldn't sleep for like a year. They always went to sleep with one eye open after that. There were 4 copycat biters within a 3-week period where penises were bitten off, okay? So the jaw is a powerful organ, you know? Those maxilla and mandibles could really do damage. No, you can't break it off. But if you get it, you could slice it off. You can have trauma in an automobile accident. It could come off. But the answer is no. No. Okay, go ahead.
No, but on Grey's Anatomy, the 2 couple were having sex, and then he said that he broke it. Was it sprained or something?
She had some small, tight vagina. Ripped that thing right off. What do you mean? She snapped it off?
I mean, yeah, but like it was like sprained or something.
Oh, hold on. No, I didn't. I'm sorry I missed this episode. But the penis is connected by 2 ligaments to your core of your body. And 2 things you need to know. If you cut these ligaments, professionally cut it, it will actually cause the penis to be dislodged from the body, and it will actually appear about 1 to 1.5 inches longer, okay? But it is possible to do damage to that. So whatever was happening during that episode, yes, it is possible to dislodge the penis so it's not connected the same way as it was before. And it can be repaired, okay? As long as there's no nerve damage that occurred with it. And just the thought of it freaks me out. But I'll have to catch up on grays. So yes, but you can't break it off. And I know many women have tried. You can't break it off. It's soft tissue. You could break a bone off. There was a guy on one of these crazy shows that had to cut his arm off to save his life. He was trapped in the mountains. That was the one show that I saw. I said, I always say, I think I could do that. Like all these heroic things. I don't know if I could do that. Cut my arm off to save my life. There was a hand. I missed my calling. I could have been a broken penis doctor or something. It happens, but we're not talking about breaking it. We're just using the wrong terminology. It becomes dislodged from where it's not gone, is it? These guys that had broken penises. It didn't disappear. It wasn't Harry Potter. Where did it go? But it becomes dislodged. I don't know what to say. It's kind of new for me. Oh, yeah, yeah. I understand exactly what has happened. You could do damage to the penis. If that's the question, the answer is yes. Can you break it? It's just a term that I wouldn't use. I would say you could damage it a little bit. You can cause pain. It could become dislodged, disconnected. Just like women have tipped uterus, guys have sometimes even tipped penises, usually not as a result of the vagina. What we need to take away from this is we have Grey's Anatomy and we have reality. They took something that's really interesting and they put it into a show. It's real, but it's not common. This is not common. They found 5 people. We're talking about a large number of people in that pool. Okay? Let's take a 1-minute break. Let me put on the next set of slides. I would rather respond to a series of questions that you might have regarding, here we have the external genitalia. You have the peritoneal tissue here, perineum, you have the anal region, you have the vaginal bowel, you have the clitoris, you have the mons veneris, you have the major and minor lips. So what questions do you have? This is the external. Of course, we have the ovaries, fallopian tubes, we have the uterus, we have stuff all over. We have hormones, we have pituitary. We have FSH, LH, progesterone, estrogen, stuff. Now, what are your questions? Anything about the female? They don't have to be in any order, yes.
What causes a vaginal cyst?
Ovarian cysts, more common than vaginal cysts, and cysts on the breast are, remember we used the word before, is it normal? As far as we know, and I don't want to give you misinformation, there's a strong genetic predisposition as opposed to anything causing it, okay? Now, I could be very cute and say, well, if you smoke cigarettes, and I can give you a whole variety of carcinogens and issues that might make you more susceptible. I'm not going to go there because the genetic predisposition is much larger than all those other possibilities that make one more susceptible. And it's a great question. So know your family history, and if you don't have one, find out what it is. My wife's family were in concentration camps, and all of her aunts and uncles were killed. And she has a very, it's only her parents that she gets information from. So we always say, well, we don't know what the real family history is. You got to go back at least, 2-3 generations. Okay? Thank you for the question. What other questions? Mm-hmm.
Why do women that live together have similar cycles?
Why do women that live together have similar cycles? Well, for those people that don't know this, especially guys, if females live in the same house, same dorm, same jail, usually you have a woman who is a little bit more dominant. And what happens is you produce pheromones, which are really a gaseous material. They don't smell, but these gaseous materials are picked up by the olfactory nerves in our eyes, and they help regulate your menstrual and ovulatory cycle. So let's say 4 women are living in a dorm for about 3 months. They all come in with different cycles. One has a 28, one has a 35, one has a 21, one has an irregular cycle, no real cycle. Chances are one of them will be a little more dominant, and they start replicating similar cycles. And it's only, what happens is, again, these pheromones will affect the secretion of different hormones that regulate and assist in menstruation and ovulation. So if you are living in a dorm, approximately a 1 semester, after 1 semester, you will see a commonality of periods. For a whole year, it becomes more than a commonality. You're shaking your head. It becomes amazing. So any pizza delivery people here, you don't want to be delivering pizzas to an entire dorm that's, menstruating at the same time, if you believe and understand a little bit about PMS. But it's really the pheromones that are picked up by the olfactory nerve. Who asked me the question? That give you some idea? Now, that doesn't scare me. The dorms don't scare me. Women who are convicted felons in a jail who are all menstruating at the same time gives me a little shiver. You know what I mean? No, we're talking about convicted felons all having the same cycle. Now, during a period, during the menstrual phase, women are usually pretty good because first of all, they're always miserable and happy at the same time. They always are afraid they won't get their period, and when they do, they're kind of happy. And it depends on where you are and whether you want to have a baby or not. I don't want to go. Let's leave that alone. Questions?
What do you think the most direct signs are that a woman would know that she's pregnant?
What was that?
Most direct signs that a woman would know she was pregnant. And everybody says there's
Well, that's a great question. It really is. What's a good sign that a woman is pregnant? Now, teaching this class and counseling and other things, I've had many young ladies come to my office throughout the years and say, I think I'm pregnant. And I would say, I try not to get involved with the lives of these, but if they came, I said, what makes you think that? Well, I missed my period, okay? So one of the first signs is missing your period. And then I would ask, so when did you have sex? Oh, I didn't have sex. Okay. We'll leave it at that. Now, the reason I say that is we have religion thrown in here. We have things that are miracles. And I just want you to know, ladies, you really need to have sex to get pregnant. That's one. But the best sign is that it's not stress-related. Stress will throw off your period. You're not amenorrheic or very low in body weight where you won't menstruate. You'll miss a period often. It's usually about a week after you will see changes. You don't glow. You look glowing. You look pregnant. There's only one way to determine. You don't have an increase in size. This is another myth. People get fat. When you're pregnant, the first few weeks, you're not getting big. By 3 months, you might show a little bit. So you can't tell right away. The best sign is having a test after you missed a period and you had unprotected sex at a time when you are potentially ovulating. And ovulation occurs approximately 2 weeks, 14 days before your next period. So someone that is using a calendar method or kind of looks at this and it says, I had unprotected sex in these days, I missed my period, and then she has a test. The real sign is a variety of things that go together. It's not one thing. It's not missing a period. It's not feeling a certain way. It's not vomiting. It's not morning sickness, you know, all that stuff. So I try to avoid the answer as best I can. It's not getting bigger. The only way, you know what the best way is when a doctor feels your uterus and your uterus enlarges in size is the best way to determine that you're pregnant. That's why you have an internal when you go to the doctor. That is the most, more than any other test. Because as your uterus grows, they could tell how your baby's doing. And I think that should not be understated enough. If you think you're pregnant, you want to take one of those quick tests. There's a lot of false negatives on that. However, go to a doctor. Whatever you want to do with the baby, go to a doctor. And in a very short period of time, there are free clinics. You'll know if you're pregnant or not. But don't do it 2 days after. Wait at least 8 days. And listen, it takes between 2 and 7 days for fertilization to take place, for the journey to take place from the fallopian tubes down the uterus, and implantation to occur where that growing fertilized egg begins to develop. So if it takes 2 to 7 days and you do this in day 2, there might be some shifts in your hormones, but I'd wait 8 days. Just saying. Did I answer your question? A good question. Yes.
I have a question based on Discovery Channel again.
I love this channel. I'm going to have to tape this. You know.
This guy studies sperm, and he said that if you want to increase your chances of having
A boy.
the male sperm is faster than the female sperm. So you want to have sex closer to menstruation because they'll get there a lot faster than the female sperm. Is that
Well, let me answer it differently. There's, let's say, 6 to 10 theories on how to increase your odds in each direction, to be male and female. Body position, use rear entry, douching, affect the pH. I could tell you all the theories. If you did everything, still there's more females that are born than males, a slight number. You're still only moving at about 1% to 1.5% if you did everything. It's a natural process. I would strongly recommend that not fooling around with that entire process. You know, who knows, douching and certain things. You hear vinegar, you hear this, you hear all these wild things. He studies the movement of sperm and the speed and all that. Well, now they could see, they can test this. But if you can only move it about 1%, and he couldn't say more. If he's saying, well, you got a 4 out of 5 chances, you could just move that dial a drop. That's about it. That's all I have to say about it. There are books about it. There's things I could recommend. You want to know more about it. I would take my chances. There's some people that try everything, boy after boy after boy after boy. You know, what are you going to do? Adopt. You know, I don't have any answers for that. But I got to check out the Discovery Channel. Yes. Question. These are good. These are good questions.
Is it true that girls who work out often are less likely to get pregnant?
No. No. But if I take it further, I could answer it differently. Is it true that girls who work out a lot are less likely to get pregnant? No. Girls who are very low in weight are less likely for any reason. Eating disorders, you're just small, gymnasts, dancers. When you drop below 100 pounds, if you can't give blood, let me start there, which I think is 110 pounds, your chances drop, you know. But amenorrhea occurs in many women who are elite athletes because they have no body fat and they're 102 pounds. So amenorrhea, whether it's primary is due to genetics. Secondary reasons, yes, they are less likely to get pregnant. But fit women are people that are flexible, have aerobic capacity, and are strong. That doesn't mean they're tiny in weight and fall into that classification. Long-distance runners often have a problem, just to let you know. It's weight more than strength and fitness. No, but you have to understand, if your hormones are affected, and you need a lot of your hormones to be secreted, you know, after you get pregnant, the corpus luteum, which lies inside the ovaries, continue to secrete progesterone for about 3 months. If you're an athlete that doesn't have enough hormones being secreted because of your weight, it is certainly more likely that you'd have problems during pregnancy. But we're starting to categorize it. There's too many athletes involved in this pool to talk about athletes. You know what I mean? Because I would say, although 70% of all adults do not exercise, this 30%, people your age, it's much higher number of people that are fit. So we start getting to the point of, when you get into over 40, 45%, engage in exercise 3-4 times a week, there's no bearing on pregnancy, no bearing on capability. But if you're an elite athlete and you've been doing this for a long time and you're less than, 100 pounds, for instance, forget the height and weight skills. When you're less than 100 pounds and you're 5'1", 5 foot, it starts affecting the cycle and pregnancy. But let's not generalize it too far, okay? They become medical issues, not health issues.
Why is it dangerous for women over the age of 40 to have a baby?
Well, it's dangerous for anyone to have a baby. The death rate is about 6 out of 100,000 women when they give birth die. It's not as easy as that. It's so natural. It's natural childbirth. Well, women die from it and have complications and all that, okay? As you get older, you're not as capable. You have blood supply issues. There's really a danger in two things. One, as each year increases, your chance of having, let's say, Down syndrome babies with an extra chromosome or some abnormality increases. So if you look at someone your age, I'm hypothesizing, it might be 1 in 10,000. When you get to be 45 to 48, using that as an example, and it's 1 in 9. Okay, so that's the first problem when you get older. The second problem is 3 days ago, I read a study that women, when they hit 30, start losing the majority of their eggs. Well, I was very upset with this study because it gives people the wrong impression. Since in each ovary you have between 200 and 400,000 immature egg cells called follicular cells, even if you got older and didn't have the full capacity of eggs, you only use about 375 that are ovulated your entire lifetime. I think those are bad things to get out there. Certainly, when you get into your late 30s, you